Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, January 26th, 2021. So we have crossed a lot of milestones this week, but at the same time, cases tend to be slowing down or trending downwards in almost every area. Worldwide, we should be crossing 100 million COVID cases by the end of the day. In the United States, we've passed 25 million, and here in Massachusetts of 500,000. However, all these areas we do seem to be trending downwards. Generally, we're getting the lowest daily case count since early December, if you don't count Christmas Day, which many places did not report. In terms of deaths, however, those are still plateaued or slightly trending upwards. With seeing, for example, we saw 600,000 fewer cases worldwide this week over the last week. We saw an additional 5,000 deaths over the week before. Here in the United States, deaths held even while cases trended down about 300,000. Looking at these graphically, you can see pretty much everything is trending down except for deaths there, which are on a bit of a plateau. Testing is also coming down a little bit, which is unfortunate. But if we actually look at the case counts, as you can see here, we are pretty much lower than anything. So that's the dip for Christmas when we did not have any reporting for a day essentially. But we are at a level that we were at, not since really early December. Looking at this weekend's case counts, Sunday is always one of the lowest days, of course, but we still haven't seen numbers that low for almost 2 months at this point. So that's really encouraging. Just around the country, you can see these are 4 different lines for the 4 different census regions, and everywhere is at lows we haven't seen for a while. The Midwest, especially in blue here, which has been trending down for a while, is at the lowest it's been since October, basically. There, but at the beginning of its really big surge there. Other places aren't quite that much, of course, because they started this downward trend as recently. The West is about where it was at the beginning of December, and some of these, even then, that's even lower than it was on the day with no reporting there. But the Northeast and the South are not quite as good there. They're still, we're in sort of an upward trajectory in early December. But if you look just around the states, almost every state was trending down from this week over last week. So it's huge there. Virginia was the only one that was going up there. I'm not quite sure what's happening there, but every other state was trending down, most of them more than 10% lower, which is great news there. In terms of hospitalizations, looking at month over month, what the hospitalizations were doing on average with January, December, November, and October there. You can see where the averages were. The purple lines are days when there was a net gain in hospitalizations, the blue when there was a net loss. And this month, we've just been steadily pushing it down as hospitalizations. We're getting more people out of the hospital than putting into them. Looking around the country, this is actually trending downwards here too. There's actually no state that has more than 600 people per million population in the hospital right now, which is hasn't been that true for a while. There's Arizona just dripping below the line, and that's some very positive trends here. So definitely need to keep this up in order to keep this going. Deaths, you see, they're still trending down in some areas like the Midwest, which has been for a while, but the South, the West are perhaps slightly going upwards there, while the Northeast is slightly down. So those all kind of level out to a vague plateau. In developments this week, a bunch of stuff's happening on the clinical side with some medication studies and developments. First up is colchicine, which is a anti-inflammatory medication. A lengthy study out of Canada just announced its preliminary results. We don't have the full data on it yet, of course, so no one's jumping to any conclusions, but their study results claim this is a very effective treatment for COVID to reduce hospitalizations and deaths. It's important because it is an oral medication rather than something that has to be given via via an IV, so they can be given something outpatient. So a lot of people are hailing this from the study press release as a big improvement, but some people are cautioning this could be the next hydroxychloroquine, which is something that has a lot of initially promising data, but turns out to be a bust. It's worth noting that colchicine, which treats things like gouty arthritis, gout, is something that can be toxic at high levels. So people are cautioning not to get over the top there. We did have some people who died or seriously injured themselves from attempting to take hydroxychloroquine last year, and colchicine is something that would be a lot more dangerous in that respect. So we're still waiting on that one. Piece of unfortunate news is that pharmaceutical company Merck has abandoned its 2 vaccine projects. It was working on 2 separate vaccines, both using viral vectors, sort of similar to the AstraZeneca program. And both projects were abandoned after just showing poor clinical results. They did not really produce a satisfying amount of antibodies in people compared to just regular infection. And so that makes 3 total vaccine projects that have been abandoned, and kind of shows just how lucky we got with the ones that have come through and at the speed they did, as it would have been very easy for many of the vaccines that were front runners to drop out at this point. So pretty glad that we have the vaccines we do. Speaking of those, there's been some studies released on the effectiveness of the vaccines we have versus the viral variants that are out there. Moderna just released a study on testing its variant on both the one circulating from the UK and the one in South Africa. So B117, one in the UK, no difference in protection there. The vaccine was just as effective against it as the vanilla COVID. However, B1351, variant coming from South Africa, did show a weaker response. The vaccine was not as effective. However, it does appear that it is effective enough. This is this difference between getting an A and getting a B minus. It's still good enough to give protection there. They're still going to pass. That said, Moderna is already working on a booster shot for B1351, and the technology does exist to make these booster shots very quickly for new variants. So hopefully, any new variants we see that are stronger against the vaccine, we can quickly get booster shots against them. So with that, let's check in quickly on the vaccine progress here in the country. In the United States, we have so far delivered 19.3 million vaccinations to people around the country. That's 8.9 million new vaccinations in the last week. We're actually really stepping up our scale here, getting where we need to be to get enough people vaccinated. Nearly doubling the number of vaccinations given. But in terms of distribution, another 10 million vaccines went out to the states, brings up to 41 million vaccines out there. Looks like about 1.6 million people total have gotten their second dose. And here in Massachusetts, we've given 433,000. That's about 180,000 new vaccinations. And we've received an additional 200,000 doses, bringing us up to 859,000 doses given to the state. Our percentage of second doses is a lot smaller, but with phase 2 starting next week, this is going to ramp up very quickly. And one final thought as we go into our week, this is Susan Ortega. She is the President Biden's selection as the acting attorney general until his initial pick, Dr. Vivek Murthy, who was the Surgeon General under President Obama, can be confirmed by the Senate, but that will take a little while. Just pointed her out because Ortega is a nurse who will be filling in the Surgeon General role. It is not the first time a nurse has filled this role, but I feel like pointing that out because public health, education, advocacy, these are all important nursing fields, and got to represent there. Sources for today's update come from our usual places, the COVID Tracking Project, New York Times, and mass.gov. For more from the MassSupport Network, you can find us on our website or on social media. Remember, Wear your mask, wash your hands, and we'll be there if you need us. Stay safe.